All right, we are live here. Happy Monday, everyone. Monday, April 20th. Thank you for tuning in. I'm here with Leysin. Hi, Leysin.
Hi. Hi, everyone.
And we are here today to talk about to continue our CL Derm webinar series for Stay Home and Stay Healthy and Stay Beautiful. And this is about a topic that we don't talk about a lot and we don't promote on our website a lot, but it's vaginal rejuvenation. And although, we don't talk about it a lot, I know it's uncomfortable for us to say and for us to talk about. We were hoping that by offering a webinar where you can be in the privacy of your home and it's totally anonymous, that you could tune in and come to learn a little bit from Leysin and ask any questions that you might have. Millions of women, a lot of us experience the same things, especially those of us that have had children or other, concerns. And there are treatment options out there available. So I hope that this might help educate you all a little bit more. Before I pass it over to Leysin, on the bottom of your screen down here are two options. One should be for a chat feature and another is Q&A. So I encourage you to use the Q&A to start popping in questions. You can pop them in now or as Leysin's talking or at the end, but she's going to give a little short presentation to teach you guys a little bit, and then we'll be available to answer any questions you might have. And also, before we begin, I have one little poll that will help us all understand where you are at in this journey. So a poll should have popped up on your screens right now. If you could all please answer and let us know where you're at. This is anonymous again. And for those of you just joining, this is our Vaginal Rejuvenation webinar with Leysin, our amazing PA. So I see some of you answering now, so I'll just give it another minute or two for if anyone else wants to answer. If not, you don't have to. You can just sit and watch and listen. I hope everyone had a good weekend and got to enjoy a little bit of our nice weather. I was very happy it didn't rain over the weekend. Okay, let's see, 3 more seconds. Will you guys press submit? All right, I'm ending this now. So let me share, for those of you that did answer, it looks like about half of you have had children and half have not. It looks like a good number of you have experienced painful intercourse, which is something that this can help with. Do you leak urine when you cough? So no one says yes always. Well, that's lucky for you because some women do, but a lot of us said yes sometimes. Do you feel you could benefit from improving the aesthetic appearance? A lot of us thought yes or maybe. And would you like to see an improvement in intimacy? Someone said no. I don't know how anyone wouldn't want to, but most of us said yes or maybe, and that is a little added side benefit of this treatment. So right now I'm going to turn it over to Leysin. Leysin is our incredible physician assistant. She's been with us for many, many years now. She's amazingly credentialed. She does all types of lasers, does cool sculpting for us. She does vaginal rejuvenation, which is why she's speaking about it today. And she assists a lot of the physicians with their treatments. So let me pass it over to Leysin. Thank you, Leysin.
Thank you, Risa, and welcome everyone. Thank you so much for tuning in today during these times. And I'm actually very excited to talk about this women's wellness procedure and vaginal rejuvenation today. We have a couple different options within our practice, and I'm going to go through them in detail. And at the end or throughout the session, if you have any questions, please don't hesitate to send them through. The poll that we just took with Risa, I have excellent news. We can help in all of those areas. So without further ado, I'm going to get started. So let's see, our first procedure is Thermiva, which is a device that utilizes radio frequency to gently heat the tissue to stimulate new collagen growth and improve blood flow. The benefits of Thermiva is tightening of the vaginal canal and enhanced lubrication, improvement in urinary incontinence or leaky bladder. It improves the aesthetic appearance of the external genitalia and an enhanced sexual pleasure by improving sensitivity. Thermiva is a simple 30-minute procedure. We spend 15 minutes on the external genitalia, and 15 minutes is spent treating the vaginal canal and bladder wall. 3 treatments at monthly intervals are necessary to achieve optimal results. A single maintenance treatment thereafter every 8 to 12 months is suggested to maintain the results. The results are immediate and continue to improve even 3 to 6 months post-treatment. The Thermiva wand. The wand is the size of your index finger and is designed for comfort. We have a picture here of the wand. It is very small. As mentioned, it's the size of the index finger. The handpiece is, the width of the handpiece is about a half an inch, specifically designed for handpiece for comfort in mind. Underneath the wand is a silver electrode that actually delivers the radio frequency or the gentle heat. Post-procedure, you will have no downtime and you can actually resume normal sexual activity immediately after treatment. So here we have a picture of the actual Thermiva, our body generator that is here in our practice. You can see the little silver electrode on the wand. That is the area where it's delivering the heat throughout the treatment. And again, it's gentle heat. It's meant to be very comfortable and it feels almost like a heating pad sensation. In our practice, we actually conducted a clinical trial, Dr. Goldman, Bolton, and Wilson for Thermiva, which included 10 female subjects aged 23 to 60. Each patient had 3 treatments a month apart. The subjects showed statistically significant improvement in physician-evaluated vulvovaginal laxity, which means tightening of the skin both internally and externally. The subjects also reported tightening of the skin internally and externally over the course of 10 to 30 to day 60 and 120 post-procedure. The subject sexual satisfaction questionnaire. Subjects showed statistically significant improvement in self-assessed sexual satisfaction from baseline at both days 60 and 120. Improvement in atrophic vaginal symptoms. As we age, we start losing estrogen, and this causes the wall of the vaginal canal to start thinning. This is where we start experiencing those symptoms of dryness and painful intercourse. These subjects also showed statistically significant improvement in the atrophic vaginal symptoms from day 10 to day 120. Improvement in stress urinary incontinence symptoms as well. The Female Sexual Function Index. Over the past 4 weeks, how would you rate your level of sexual arousal? Patients were able to see a statistically significant improvement in sexual arousal starting from baseline all the way up to day 120. Over the past 4 weeks, how difficult was it to maintain your lubrication until completion of sexual activity or intercourse? You can see that there was a statistically significant improvement as well in vaginal lubrication after 3 treatments. Over the past 4 weeks, when you had sexual stimulation or intercourse, how often did you reach orgasm? Again, patients after 3 Thermiva treatments were able to notice a nice improvement in sexual stimulation and ability to reach orgasm. All right, so now we're going to switch directions to our other device that we use here at our practice called the Viveve. This device uses cryogen-cooled radio frequency to gently heat the tissue. Cryogen helps cool the surface of the skin to more effectively deliver the heat targeted tissues to promote new collagen growth. The benefits from Vivve: tightening of the vaginal canal, stabilizing the bladder wall to improve urinary incontinence, enhance blood flow to improve lubrication and sexual arousal. Vivve is one 30 to 45-minute treatment session, focusing on the vaginal canal and stabilizing the bladder wall. Maintenance treatments after that one single treatment is annually or as symptoms come back. The procedure is comfortable and safe. Results are noticed 1 to 3 months post-procedure, and there's no downtime. You may again resume normal sexual activity immediately after treatment. Here's a picture of our Vivve device and actually the treatment tip. And you can see there is again a silver rectangle at the treatment tip that is actually the area where the gentle heat from the radio frequency is emitted. So again, it's an elegantly designed for patient comfort. And this is the Vivve. So a clinical research study by Crickman in 2017 studied results 1, 3, and 6 months with 174 patients to show the safety and efficacy of Vivve. It was a multi-center randomized blinded sham-controlled IRB approved study. The results: statistically significant changes in the female sexual function index score. And again, the female sexual function index score is a validated questionnaire that assesses different domains of sexual function, such as desire, arousal, lubrication, orgasm, satisfaction, and pain. All of these patients noticed an improvement in that area. Treated women were 3 times more likely to experience no vaginal laxity, and 80% of subjects in the active treatment group showed an improvement in vaginal laxity at 6 months. No related serious adverse events. Now, how do I know if I'm a good candidate for either of these procedures? This kind of goes back to our poll that we took in the beginning. Have you experienced vaginal childbirth? Would you like tightening of the vaginal canal? Do you feel loose during intercourse? Do you leak urine while exercising, sneezing, or coughing? Do you feel like the aesthetic appearance of the labia is not how it used to be? Are you experiencing painful intercourse or dryness? Would you like to improve intimacy and sensation? Now, in preparation for either treatment, please plan to bring a copy of your normal PAP within the last 3 years. We do like to have you have a history of a normal pelvic exam every year as well. You come in with a clean shave the day of treatment, or you can wax the day before. No presence of an intrauterine device except for the Mirena. No electrical devices such as pacemakers, defibrillators, etc. And no mesh exposure, and to be 6 weeks postpartum. All right, thank you. And I'm open for any questions that anyone might have.
Thank you so much, Leysin. That was really helpful.
Welcome.
So if you guys can, on your screen, start popping in a few questions for Leysin. She would be happy to answer. If not, I'll go ahead and start off with what we have right now. So let's see. I have had 2 children, and you know, does this I'm interested in the procedure. Does it hurt at all?
So it is very comfortable. Either procedure is very comfortable. It's gentle heat that you're going to be feeling, and it's nothing more than like a heating pad type sensation. Each procedure we utilize a warm either ultrasound gel, which is warmed ahead of time to basically keep the temperature of the skin and the electrode very similar. And then with the Viveve, we use a warm coupling fluid. So it's meant to be very comfortable.
Okay, great. Here's another one. Is there a good age group that's best for this?
Really, all ages can benefit from this. This is a procedure that we have a lot of inquiries from very, very young in their 20s all the way up into their 70s and 80s. Everybody can benefit from this, whether it's skin tightening for the external appearance, tightening in the vaginal canal. Really, every age group is an excellent category for it, starting in your 20s all the way up.
Okay, let's see. Does either treatment help with urgency incontinence?
So yes, we can help with urgency incontinence. With the Viveve is specifically designed. It's nice to be medically treated for the urgency, because the stress urinary incontinence is really the goal for either of these treatments. But if you're medicated on a medication from your physician, it can actually enhance the results of the medication for urge urinary incontinence as well.
Okay, great. Here's another one. If you had a total hysterectomy, can this still work if a normal pap smear is not done due to removal of ovaries?
Yes, we can definitely still help with patients that have had total hysterectomies.
Okay, great. Here's another one. I have not had children. I feel the entrance to my vagina has shrunk, causing pain during relations. Is there any solution besides cutting?
So by enhancing blood flow to the area and lubrication to the area, this should help to make the introitus a little bit more comfortable. I would definitely consider giving Thermiva a chance for that specific concern.
Okay, great. Let's see, where can I see some photos of this? So I can help answer that. We are actually going to be uploading some to our website for you all to see. But I know, we didn't want to show them in this presentation just in case any of you are, I don't know, around kids and we're streaming live on Facebook and I think that would not be okay with Facebook. But if you are interested, if you want to pop in your email into the chat, or if you want to send us an inquiry after this, we'd be happy to send you a link so you can see some before and afters, because there is actually a big visual improvement that you can see in addition to the feeling. Okay, does anyone else have any questions to ask? Leysin, what's the most common question that you get asked?
Well, I think a lot of patients are concerned about tightening in the vaginal canal, especially those that have had childbirth and increasing sensitivity to the area, which both procedures can do. I would say that's probably the most common question I get asked is, can it help with tightening in the vaginal canal, and what can I expect as far as sensitivity and improvement with intimacy? It truly does work. I have a lot of patients that come in every 6 to 8 months to repeat the treatment because they're so happy with the results. And, it is a sensitive subject. I'm definitely aware of that. And so we do have private consultations in the office, and it's great that I can reach out even today and have everybody's anonymous, like Risa said. So ask away and nobody will know that you're asking. I'm happy to answer any questions.
Okay, great. And I know some of our staff members have even had this done and they've really been happy with it. What kind of feedback do you hear?
Excellent feedback from the staff. Again, they're regular patients. They come in regularly for their treatments. The Thermiva, again, it's every 6 to 8 months, and Viveve, it's once a year, every 8 to 12 months after the single treatment. I've got very happy patients and staff that are regular followers.
Okay. Here's a question. Would your partner know that you had something done or something changed?
Yes, and especially with Thermiva, we have patients that report that their partner can notice the tightening even that night after treatment, and I've had that feedback from patients and staff as well.
Okay. Oh, I guess that brings up another question that I imagine some people are having, but how, when can you have sexual intercourse again? Do you need to sustain? How does that work?
Immediately after treatment, you can with either treatment.
And the results are immediate.
The results are immediate. Yep. So even that evening, you'll notice improved pleasure and tightening of the canal. And then over the course of time, again, as collagen is building, you're going to get more tightening and more improvement over time, over 4 to 6 months following the treatment.
So are there any risks or concerns or people that wouldn't be a candidate for this?
Well, as mentioned in the presentation, we don't want patients that have any electrical implanted devices because it is monopolar radio frequency, so it would interfere with the electrical implantable devices. Otherwise, we'll mesh exposure to mesh within the last 5 years or any mesh procedures. IUDs other than the Mirena. And that, if you have an active infection, like an active sexually transmitted disease, we obviously wouldn't want to treat. If you do have history of herpes simplex virus type 2, we can prophylactically treat you ahead of time so that you're still able to undergo treatment, which is great. Any active urinary tract infections, we wouldn't want to have you treat that until you were currently over the urinary tract infection. That's pretty much it as far as contraindications.
Okay. And one new question about any side effects.
No side effects. There might be some slight tissue pinkness post-treatment. But as far as any side effects, no. You might have with the Viveve, there could be a little bit of spotting post-procedure with Viveve only. But otherwise, no, there's no side effects.
Okay. All right, great. Let's see. So I know there's not I don't have any more questions from you guys right now. I know it's a sensitive topic and you might not even want to type them in. So I was trying to see if I could think of any that some of you might be thinking about, but overall, I just encourage you to, you could Google more online to look at Thermiva and Viveve. You can look on their websites. They have before and after photos. You can email us and we could send them to you. We will be uploading a couple to our website soon this week. But otherwise, I hope you just know that it is a treatment that we offer. It is a service that is available for you. So if you, do have any concerns or you're, self-conscious about any of these things, just know there are options. It's not, overly expensive. It's not, there's not a lot of risk, as Leysin said, and the results are pretty immediate. So, if any of you are struggling, I do encourage you to, consider it as a way to help for self-care, to help yourself.
Yeah.
All right. Any final words, Leysin, before we sign off?
No, I hope to see everyone in the office for a consultation and sometime very soon. And thank you for tuning in today and reach out with any questions that you may have.
Okay, great. Well, thank you so much, Leysin. And just a reminder, we are available for one-on-one virtual consultations now. We hope to be opening up again soon, hopefully in the next couple weeks. And on Wednesday, we'll be back with our final webinar of this specific series with Farzaneh, speaking all about skincare and esthetician treatments. When we close this down, you're going to get a survey that pops up. We'd love any feedback you have and maybe any ideas for next webinars, because we're right now trying to plan our next round to keep this going, because we've gotten a lot of good feedback. So any topics you'd love us to talk about, please let us know. And otherwise, I hope you all have a great rest of your Monday, and thank you so much for tuning in.
Thank you.
Bye.